How much does Medicare advice cost? If I told you it shouldn't cost you a penny, what would you think? Some people say, well, I'm getting ripped off then because they're charging me. And others would say, well, free advice is worth exactly what you pay for it. And actually, both of those could be true. It just depends. How much does it cost? Well, a lot of that depends on you. It's not so much the person you're talking to as it is how much you are willing to pay. And it goes beyond just the monthly premium. I'm Bob Vineyard, your Medicare expert with the Georgia Medicare Minute. Okay, a lot of folks look at health insurance, and in particular Medicare insurance, and some of them have the attitude, well, I've been paying for insurance all my life and I've hardly ever used it. If I can get by without paying anything, that's what I'm going to do. And those plans have a cost to them. You may not be aware of it. You may not think of it in terms of, well, how much is this thing really going to, how much is this no premium plan really going to cost me? But it's something you should take into account. By no premium plans, I'm referring to Medicare Advantage plans. When you get a Medicare Advantage plan, you get your benefits from an insurance carrier. You're not getting them from Medicare, but you're getting them from insurance company. You've opted to take Aetna, Humana, Blue Cross, whoever is out there writing business this year. You've opted to get your benefits from them. And many times, those plans do not have a premium. And you say, well, what could be better than that? But some people also say, what's the catch? Well, the catch is that they're great as long as you don't use them. When you have to use them, especially for something serious and costly, they can get rather expensive. So the plan that you don't pay a premium for could end up costing you $3,000, $4,000, $5,000, $6,000, $7,000 out of pocket or more. And especially if you don't follow the rules. By following the rules, I mean making sure that you're dealing with a provider that accepts that particular plan and participates in it. All right, that's the plans that don't have a premium. Let's go in a different direction here. There are actually people out there that will charge you an upfront fee, $400, $500, $600, and they may tell you, well, we don't take any commissions, but there's a pony in there somewhere in that hay. Because basically, as far as Medicare products are concerned, Medicare Advantage, Medicare Supplement, Medicare drug plans, even, well, actually there's a few Medicare drug plans that do not pay a commission. But as far as I know, there are no Medicare Advantage plans or Medicare Supplement plans do not pay a commission. So just because somebody says, well, I'm going to charge you $500 and I won't take any commission, well, they may not be taking a commission, but you can better believe that whoever they're working for, that agency is collecting money on the back end. And I've always wondered about folks, not just in the Medicare business, but I always wondered about these folks that charge a fee. Okay, well, what if you don't like their advice? Can you get a refund? Or, how do you know that they're giving you really unbiased advice? I mean, this is one of the arguments that a lot of the folks on the radio will argue. I'll go with somebody who charges you a fee because they're not biased. Well, yeah, if you buy that, I've got a bridge in Brooklyn to sell you. Yeah, there's or maybe it's London, whichever it is, one of those old expressions. I would be hard pressed to believe that somebody who's charging a fee is not biased because, again, the agency or the company they work for is collecting commissions and bonuses, and so they're probably saying, I can't prove this, but it's a pretty good educated guess. They're probably saying, well, this carrier over here is paying us a lot of bonus money, and they're paying us a high commission than anybody else. So we really like you to push them if possible. Yeah, like I said, I can't prove that it happens, but I'm pretty sure it does. All right, so now we've covered the ones that, well, they don't have a premium, and we've covered the ones that charge you an upfront fee. What about going direct to a carrier, or as opposed to going through an insurance agent? Well, going direct to a carrier, first off, you're never going to talk to the same person twice. You're only going to get information on that particular carrier's plans, which may or may not be right for you. So what are you going to do? There's about 30 or 40 carriers currently writing Medicare plans in Georgia. You're going to go to all 30 or 40 of them and talk to them. How are you going to compare them? There's all kinds of issues here doing that. But let's get it back to somebody who charges you an upfront fee or doesn't. And a lot of times, not always, a lot of times people will ask me how I get paid. And my answer is always the same. Well, first off, I don't charge an upfront fee, and I don't get paid until you're completely satisfied and you want me to help you in completing the application and answer your ongoing questions and so forth. That's when I get paid. And yes, I do get a commission. It's built right into the rate there. So if I recommend an Anthem plan, for example, and you say, well, gosh, that sounds pretty good. Can I go direct to Anthem and get a lower rate? No, you can't. You'll get the same rate that I quote you. So there's no advantage to you to going direct to a carrier after you pick my brain and said, okay, well, that sounds pretty good. Thank you for your advice. And I do have a few people say that from time to time. And some of those people will actually call me back 6 months, a year later and say, well, I should have listened to you. And I said, well, yeah, I guess you did. Sorry it didn't work out, but you burned that bridge. So it's not personal, it's just business. But so anyway, there's, how much should you pay for advice? I don't think you should pay anything until you're completely satisfied. And we've had a lot of work done on our house in the last year or two, and every one of them that's been here, a roofer and a plumber, and they didn't charge me anything until the work was done and I was satisfied. And I kind of like that approach. And that's the way my business model works. I don't get paid until you're satisfied. So if you like that, give me a call. I'll be glad to help you out. This is Bob Vineyard, your Medicare expert with the Georgia Medicare Minute. You take care. Have a great day.